Hi friends, my name is Dr. D. I'm intensive care doctor and created this channel to share fascinating and useful medical knowledge with you. Here I explain complete diseases, conditions, symptoms, and prevention in the simple, easy to understand why everything to help you better understand your body and your health. Subscribe to the channel and hit like button. Help me reach my first 1000 subscribers. Your support means a lot and motivates me to keep going.
Today we'll talk about a phenomenon, about a word that almost everyone knows, a word that is mentioned everywhere. There is no TV program about adult health or nutrition where you wouldn't hear this term. Cholesterol. This word is connected with many things: medications, supplements, diets, lifestyle recommendations. And of course, when something is talked about a lot, it generates fears, myths, and misconceptions. Today I'd like to analyze 8 common myths about cholesterol. Myth 1. Cholesterol is something terrible. This is more of an emotional reaction. Horrible, dangerous, unnatural. Keep it away from me. In fact, cholesterol is very important, natural, and useful. For many years it was considered a lipid, though chemically it is closer to alcohols. In some countries it's traditionally called cholesterol, in others cholesterol. But the main point is this: cholesterol is essential for the human body. It is the basis for hormones such as progesterone, estrogen, testosterone, and adrenal hormones like cortisol. It is also a key component of cell membranes and plays an important role in digestion. Every day, the human body produces about 1 gram of cholesterol naturally, plus about 200 milligrams comes from food, so there is nothing to fear. Myth number 2. If my test shows normal cholesterol, I don't need to worry. The problem is that cholesterol is not a single substance but a group of different compounds. In the blood, it exists as lipoproteins, cholesterol bound to proteins. There are bad low-density lipoproteins, LDL, and good high-density lipoproteins, HDL. What matters is not the total cholesterol number, but the balance between these fractions. Myth number 3. If LDL, bad cholesterol, is normal but total cholesterol is high, it's safe. Not true. Imagine a road designed for 100 cars, but 200 are driving on it. Even if all cars are good, the road will still get damaged. High total cholesterol is always a signal that something is wrong and should be analyzed by a doctor. Myth number 4. If all my results are within the normal range, I can relax. Unfortunately, no. Laboratory norms are calculated for people without additional risk factors. If you have high blood pressure, obesity, diabetes, smoking habits, or a family history of heart disease, then even normal cholesterol levels can be dangerous. In such cases, doctors aim not just for normal, but for even lower levels. Myth number 5. Cholesterol is dangerous only for the elderly, for men, or for overweight people. False. Risks exist for women, for slim people, and even for young individuals. High blood pressure, smoking, genetic predisposition, and poor eating habits have no age or gender boundaries. That's why after 30, everyone should check cholesterol at least once every 5 years. Myth number 6. If I had high cholesterol, I would feel it. No, you wouldn't. High cholesterol has no symptoms. The only way to detect it is through blood tests. Myth number 7. Half of the treatment is diet. Nutrition is indeed very important, but let's remember, out of about 1200 milligrams of cholesterol in the body per day, only around 200 milligrams comes from food. Diet can influence only about 1/6 of cholesterol levels. The rest depends on lifestyle and in many cases medication. Diet is important not because it removes cholesterol. Cholesterol itself is vital, but because the wrong foods, excess sugar, fats, trans fats, can trigger the overproduction of LDL. Myth number 8. If I take cholesterol-lowering medication, I can relax. Absolutely not. Treatment works only as part of a comprehensive approach: a healthy diet, physical activity, giving up bad habits, monitoring waist size and body mass index, and regularly taking all prescribed medications, not just those for cholesterol, but also those for blood pressure and heart function. Conclusions. Myths are born out of fear, misunderstanding, and overconfidence. Now you know what is truly good and bad. Make sure you get your blood tests done properly and on time, manage your risk factors, and follow your doctor's advice. Stay healthy.